Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins me now. Happy New Year.
Happy New Year, ma'am. We survived 2020.
We survived. We'll talk about 2021 because there's a lot to unpack as we move into the new year, but bring us up to date on where we're at with numbers. We've made it through Christmas and the New Year's. How are we doing?
So yes, we've made it through Christmas, but we are starting to see our numbers trend upwards again from where they were on Christmas Eve and Christmas Day. We're not at post-Thanksgiving levels yet. But we are halfway through the 14-day period that we look at for Christmas. We know that COVID infections occur between 2 and 14 days. So we've got another week to go. I would expect to see those numbers probably continue up a little bit more, but hopefully we've learned our lesson from Thanksgiving and we don't see quite as many numbers or quite as high numbers.
Great expectations for 2021. We've got a vaccine that's rolling out. A lot of questions regarding the vaccine. What are some of the questions you guys are getting there at the health department? And can you kind of help people bring them up to speed on where we're at locally?
Sure. So we get a lot of questions asking, when can I get mine? That's from, all age groups. That's from all sorts of different professions. And the short answer is we don't know yet. If you're not a healthcare provider working directly with COVID patients or in a long-term care facility, EMS, or a COVID tester, we generally don't know who's getting vaccinated yet. We hope that we will know next or as early as this week who that next target audience is. I suspect it will be first responders and the aged population, probably 75 and older. But until the State Department of Health gives us our guidance, we don't know who we're vaccinating right now.
You may not know who, but I'm certain that you guys are already planning for this.
That is true. Sorry, go ahead.
You go ahead, yeah.
So yes, we've been planning since the beginning of this that one day we're going to be vaccinating, and we are zeroing in on it. We do have locations planned out. We do have hours of operation planned out. The one thing that we do struggle with is staffing. We do have to keep our doors open here at the health department and provide all the services we normally do, even at a scaled back rate. So we are looking for folks that want to volunteer to assist us as we go on the offense against COVID. We just spent all of 2020 in the defense, and now it's our turn with the ball. And, we need people to step up that have that medical background that can provide vaccinations.
Is there going to be a way to sign up for that, or how can they reach out to you if they want to help?
Yeah, so currently what we can do is you can sign up through the State Department of Health's website. If you go to the healthcare professionals page, there's a link right there to the Bowen Center over at IUPUI. And we are also working on a feature here at the county level that will help us get you onboarded as well. And one of the things we need to do is, to make sure that we get you covered for liability and everything else, is we need to do a background check and things like that. And at the local level, that's what we're trying to get established right now for workers. So please, if you are interested, go sign up at the Bowen Center, and then we will make sure that we are pushing out on social media and every outlet we can that volunteers can also go to the county site and get going on their background checks and that stuff as well, so we can get folks on board and keep them protected as well.
Fantastic. So the State Department of Health adjusted how it's determining percent positivity in the last couple of weeks, which meant last Wednesday, a lot of counties went to red that had previously been in orange. We were lucky enough to stay in orange. What are things looking like right now with those numbers ticking up? Any predictions for Wednesday's announcement?
We're still in the orange. I've not heard what next week's going to bring yet. However, our all tests positivity is up to 14.2 as of the 2nd. So we're probably getting very close. Our infections per 100,000 is almost, I believe it's almost 400 people per 100,000. I'm sorry, it's almost 500 people per 100,000. So we need to get that number down as well. Those are the two metrics they do for the county status score.
Anything else you want to add? I didn't ask. Any thoughts as we move through this week ahead?
Yeah, we're all excited about the vaccine. That's what's going to help us get back to our daily lives. But until then, we still need to manage those proactive measures of washing our hands, socially distancing, and wearing our masks when we're in public. The one thing I will say is the data I have seen is showing that by us doing that, we're seeing a much more mild flu season as well. So, I mean, there's the added bonus to us taking these measures. And, if we keep going forward, we'll keep seeing that mild flu season as well.
Fantastic. Chris Walker, Emergency Preparedness Coordinator. Thank you again. We'll check in with you next week.
Thank you, ma'am. Have a great week.